Subudhi sir is here. So Subudhi sir will be having his talk on prediction and prevention of post-operative displeasure by modern technology. Yeah, so pleasure and displeasure both are associated with modern technology. I do agree to that. So sir will be showing us the other side of technology.
Here.
Thank you, ma'am. So, give me the opportunity to speak before you. I thank once again the AIOS giving the opportunity to speak in this forum. And unhappy patient is very common in everybody's practice. If you do 100 cases of good patient, but if you one unhappy patient, he will spoil your whole practice. So the best example being recently what you've seen in the media.
Sit by myself, talking to the
But once the surgery was over, arey, ye kya hua? And he started all this hype in the media. Everybody in the last 3 months back have gone through a lot of, outrage against the doctors. But if you see, the doctors are never at fault at that time. So unhappy patient is very common without doubt. One miserable moment in the life of an ophthalmic surgeon is unhappy patient. No matter how experienced or careful the surgeon is, despite the best efforts, there will always a small but vocal group of patients who are simply not happy with the results, more so when it is a VIP, like SRK. So, whatever best you can, if you are very much skillful surgeon also, but you are likely to get unhappy patient, you must be prepared for that. So, as you know, cataract glaucoma patients, unhappy is very common because whatever best you do, but still then the results are not very good. But it is most common today in patients with getting operated for cataract because you got a lot of gadgets available for you to give a max vision. And still then, in spite of that, also if a small mistake happened anywhere, not the surgeon's mistake, but it's really become a lot of sound in the media. So many times there is a balance between the surgeon's expertise and the patient's expectation, but nowadays the patient's expectation is very high because they pay more, lakhs of rupees they spend, so they expect more. So gone were those days, the Sushrut era, when just simply pushing the needle, with the cataract lens, and the patient were very happy. And now, present day of Kalman era, in spite of all our efforts, still we are not able to give a happy patient to all of our practices. So this is the results of present day is a phaco, femto, multifocal and more. So expectations has gone high. So even a 70-year-old man or 80-year-old man expects just a vision like a child he wants to do after cataract surgery. With the wide array of choices in the surgeries and the IOLs that are becoming market of ophthalmologists, is offering to the patient, these days patients are very much choosy. And the best part about the media really creates a problem for us because everything is available in the Google. So once the patient comes to, he does a lot of homework at home before undertaking the surgery. So sometimes the surgeons are very much annoyed. They put a board in their clinic that patients will be charged extra for annoying the doctors with self-diagnostic gotten from the internet. So really it's happening in everybody's practice. The source of displeasure both pre-operative, post-operative, a number of tests, because nowadays as the accuracy is gone, so we need all these tests to give the accurate, so patient is really tired of coming to our clinic, undergoing all these tests for more than 1 or 2 hours. And again, a big consent form is available to sign, not only him, for his relatives also. That is also very much displeasure by the patient. And post-operative, of course, anesthetic complications, suture and wound related problems, post-operative astigmatism, erroneous IOL hampering in the clarity of sight, unrealistic patient expectations, and to add to those, reckless remarks by our fellow ophthalmologist. If he has done something gone wrong, something bad, the patient goes to the next ophthalmologist, "Hare, what did he do? He has taken so much money, he has not done." This is very common by our old fellow ophthalmologists, so one should avoid this. Anesthetic complications, as you know, even we have gone from the era of no anesthesia in the Sushrut era to the peribulbar, retrobulbar, and nowadays, of course, our rescue the topical only mindset. If you can do topical, and I can give a really best happy patient, because one prick in peribulbar remains in the mind of the patient. Always says that, "Sir, still the prick is pricking me." So topical anesthesia definitely gave a very good rescue, and surgical wound, a lot of calculations have been done to prevent this post-operative astigmatism. Every surgeon has devised own technique of reducing the astigmatism. So the incision has gone from smaller to the 0.7 millimeter to give the best results to the patient without any astigmatism. Suture-related problems, nobody wants to have sutures. Definitely sutures are nowadays null, and the suture companies have closed down. Foldable IOLs, yes, lot of foldable IOLs are available in the market. Today, one lens, tomorrow another lens, and whichever the company, motivates you, you go for his IOL, and you say that this is the best IOL. But if you surgeons, and this is one of the, you have to choose. There are a lot of competitive market, lot of lenses, lot of surgeons, companies lucrative and incentive to the doctor. So all these things are presenting a choice of IOL. Again, IOL power calculus is very important. If you make a small mistake in IOL power calculus, you will land in SRK phenomena. So I will say that SRK phenomena, because why SRK was very unhappy because of this only. So a dream of a new vision. Every patient, when comes to your clinic, he expects a new vision. He doesn't want to use any glasses. So a perfect vision for both distant and near, and that stimulates us to produce a multifocal IOLs. But multifocal IOLs is a limitation. The surgeon has to choose which patient should go multifocal IOL with a trifocal, monofocal. You have to choose. That's the most important decision you have. So multifocal IOLs is where the technology modernized to rescue with us the modern gift of multifocal IOLs. But still, even if in spite of multifocal IOLs, also patients are very unhappy. So now they come with a toric IOLs, again, still pushing the limit of optics to help those with the preoperative astigmatism to achieve excellent positive result by the important interest of toric IOLs. So multifocal toric IOLs are now the need of the hour, but in spite of this lens also, there is a small group, it may be 0.0001% of patients, they make your life a hell of a trouble. So be careful, counsel the patient properly, probably you may not expect the good result. So modern technology, whatever they help us, but still there is a lot of things to gather knowledge, because there's a media is other hand against us. And the patients are now mostly demanding and are impatient and seek immediate gratification, have unrealistic expectation, and above all, have a lesser and lesser faith in their surgeons, because you have paid money, so they lose their faith in the surgeons. So to conclude, many a times post-operative vision fails to up to the mark, whatever you do, not due to the surgery, but due to the pre-existing issues like diabetes, hypertension, old age, so many things, macular degeneration. But the various tools of modern science, it's today in our capacity to detect them pre-operatively, counsel them properly before undertaking the surgery. Most importantly, counsel the patient so as to avoid post-operative displeasure by patient, mostly if it's a VIP patient. So thank you very much. I think I could give you comprehensive. Be careful before doing your next surgery. Thank you.
Thank you, sir. You have rightly shown the other side of cataract surgery. So as we are seeing in ophthalmology, inpatients are becoming less and impatient patients are becoming more. Doctors, they just need to be patient with the patients who are not patient. So any questions or comments on the whole session from the house, the audience, and convener, sir?
So I just wanted to share with my junior colleagues that sir has beautifully explained the whole thing. But once, in case you, God forbid, if you have a complication, the best time to talk to the patient and the attendant is right after the cataract surgery. Do not send, once you have a complication, do not send to the ward that I'll finish all the next 10, 15 cases and then go and talk to the patient attendants. Once you call them to the changing room, they are most forgiving at that time. Everybody knows and understands that any complication can happen when you're doing a surgery, but when you talk to them at that time, they are most forgiving. So it's a good idea to talk to them right away rather than to keep them waiting for the end of the day and then talk to them. But a very nice presentation.
As you said, that's right, but when a complication occurs, they immediately become panic, and if it's a VIP patient. So the panic creates all the problems. You.
Not only VIP, sir, anybody, and if you operate on anybody and any complication happens, even if it's a poor person, you should call their kith and kin and then talk to them at that point itself.
Sir, a question for you. Who operated on Shah Rukh Khan?
No, my question is what actually happened to Shah Rukh Khan? What was the problem?
There is, I think, miscalculation of the IO, I believe. There's a miscalculation. I don't know exactly, I can't say. But I heard that he has undergone LASIK surgery earlier, probably there is something happened with the doctors. Otherwise, the lens was in proper place and everything was quite good. Maybe some surprise in the
I will calculate.
diopters, I would say.
But thank you very much.
Thank you.
We'd like to
Thank you
thank
very
the audience also for being